Hi, I'm Bruce Davis, the IDD Director of Behavioral and Psychological Services. I'm here today to talk to you about intensive behavior residential services. Are they the right fit for the person that you support? What are intensive behavior residential services, or IBRS? Well, it's a clinical intervention to help improve someone's behavioral health. It's appropriate for people who may have had some difficulty in emotional management, so difficulties with things like anger or depression. Perhaps people who have had difficulty with interpersonal relationships, getting along with others. And for people who've had difficulty dealing with stress, so responding to those situations in an adaptive and healthy way. Each IBRS program has a clinical director who oversees the treatment there. That clinical director is either a board-certified behavior analyst, a licensed psychologist, or a licensed senior psychological examiner. The setting involves two four-person homes that are in close proximity to one another with a shared staffing arrangement, meaning that staff from one home can be borrowed by the other if the situation dictates. The treatment milieu at IBRS includes several components, including a group setting for treatment. So these are residential habilitation agencies, and up to 4 people may live in a single home. The treatment milieu at IBRS includes several components. Some of the components that it may include, first of all, individual and group psychotherapy. So each individual who's admitted there will have a therapist who works with them to help them achieve their treatment goals. They also have the opportunity to work together to accomplish those goals in group psychotherapy. Programs typically include a level system. A level system is a behavior management tool that helps people increase their privileges with the success that they experience in treatment. So as they improve, they get more and more privileges. They also get increased opportunities for independence with progress in the program. The IBRS milieu includes highly trained direct support professionals who will have received training in crisis management that goes beyond what typical direct support professionals have received. And the staffing ratio within the program is determined by the agency. So I mentioned that shared staffing arrangement before. Each agency is allowed to take that shared staffing arrangement into account as they develop their staffing ratio for each home. The expectations of the IBRS provider are many. They include, first of all, that they're going to provide interdisciplinary treatment. So that means if a person needs psychotherapy, that will be provided. If they need behavior analysis services, that will be provided. If they need psychiatric services, those will also be provided. Whatever services a person may need to treat their behavioral health condition must be arranged for by the agency. They'll arrange for all of the necessary treatment and assessment that a person may need. They're also expected to conduct frequent evaluations of progress. So as the person moves through the program, that they monitor their success through graphs and other monitoring systems, and that as they go along, they make appropriate adjustments to the treatment to ensure that the person is being successful. They also communicate with the circle of support regarding the person's progress. And typically, at least on a weekly basis, they should communicate with the conservator to let them know how the person is doing. And at the conclusion of treatment, they are required to design a plan for the generalization of the results that they have had with the person while they were in IBRS. So as they move to their new agency, they make recommendations for what types of plans and what types of supports need to be in place to help the person be successful. So the question is, when is IBRS the right fit for a particular individual? Well, I think one of the first things you need to think about in this is whether the person might be more appropriate for semi-independent living. Sometimes the staffing ratio that a person has lived under, if it's extensive, particularly people who have lived under a 2-to-1 staffing ratio, may have more problems because of increased interactions with staff. So for that reason, semi-independent living may be an alternative to going to IBRS for treatment. The program is typically for people who've experienced persistent types of behavioral health difficulties. So not just behavioral health difficulties that may have emerged over the last month or even 2 months, but behavioral health difficulties that may have been in place for 6 months to a year to even longer. The program is for people in the mild to moderate range of intellectual disability. So many of the treatments have been specifically designed for that population. The program is also for people who have the capacity for increased independence. So if we don't believe that a person can move from a higher staffing ratio and be successful within a level 4 placement within the DIDD system, they're probably not appropriate for IBRS. And finally, it's important in every situation that informed consent is provided before the person enters the program. The conservator for the person must understand every aspect of that program before the person enters. This is not simply something that we have to check off the box with, but something that is very important to ensure that people clearly understand that, and it becomes part of the treatment as much as it is a requirement. The other aspect of this is that the person's agreement to be in the program should be obtained as well, if possible, because when that person agrees to the treatment and understands fully what it's going to be about, they're going to be a much better participant. So I'm going to talk to you about the steps involved in accessing IBRS. The first step is to contact an agency that provides the service. There are 2 agencies currently that provide the service. One is Support Solutions of the Mid-South. They provide an 8-bed IBRS facility in Middle Tennessee. And there is DNS Residential Services, who provides a 4-bed residential habilitation home in West Tennessee, Memphis area. So you'll contact one of them to determine if they're available to provide the service. The second step is that you determine if their milieu is appropriate. So you want to evaluate every aspect of what they offer, evaluate their ability to provide individual and group psychotherapy, their ability to provide a level system that's appropriate for the person that you're referring to the program. You want to evaluate their staff training to ensure that that is going to be adequate to support the person that you're referring to the program. The third step is to complete the IBRS intake referral form, which is found on the DIDD website under the Behavior Services tab. You can also find it through the link that's provided here. That referral form includes a lot of ancillary information. We need a lot of historical information, behavior analytics services information that will help us make a decision about whether this is going to be the appropriate treatment for the person. The fourth step is that the IBRS agency will conduct a risk assessment of the person. This is just to determine that they're at an appropriate risk level to be served in this type of residential setting. Some people may go beyond what is needed for this setting, or what might be appropriate for this setting. And so if that is the case, we'll try to make referrals to other programs that exist within the state. Some people may not have behavior that warrants the use of intensive behavior residential service. So we'll also divert to other services that may be appropriate for those individuals. Step 5 is that the agency will send the risk assessment and the intake referral form to the statewide clinical review team for review. The statewide clinical review team will look at the information and determine if the person is a good fit for the program. Step 7 is that the ISC submits a service plan to the regional office for approval. That service plan will be approved both by plans review and by the transition team in each regional office. Let me talk to you a little bit about the length of stay in intensive behavior residential services. We typically expect that it's going to be a 6 to 12 month length of stay. The progress for the person will be evaluated every 6 months, and we'll make a determination at that point if the person needs to continue in intensive behavior residential services. The ultimate goal of IBRS is to help the person be successful within a level 4 placement in the DIDD system. And it's not expected upon admission to the IBRS program that a person is going to return to the original agency that served them. So in many cases, they will be going to a new agency. It doesn't rule out the possibility that the originating agency will provide the ongoing services, but they're not required to do so. In summary, IBRS may be the right program for some individuals. I want to reiterate that informed consent prior to entering the program is critical, both for the conservator and for the person supported. Referrals are approved by the IBRS agency first, then by the DIDD clinical review team, and then by the regional office plans review and transition teams. Referral information for the IBRS program is found on the DIDD portal under Behavior Services. If you have any questions about anything that I've talked about, please contact me, Dr. Bruce Davis, at 615-532-1610 or bruce.davis@tn.gov. Thank you very much for your attention.